The next four chapters, which are on the cranial nerves, the brain stem, the visual system, and the vestibular system, we are not going to go into a lot of detail. We're going to talk about primary functions and a little bit of detail. So there's a ton of information in the book. We're going to really narrow it down a lot and just kind of touch on the high points of each chapter. Since they're all in 1 week, we're not getting into detail on them. Cranial nerves are super interesting, and there's all sorts of interesting pathology that goes with it, but we are just going to list the cranial nerves and their basic functions. So, cranial nerves all originate at the brainstem, somewhere on the brainstem. They exchange information between the peripheral nervous system and the central nervous system, and they serve sensory, motor, and autonomic functions. Most spinal nerves have sensory, motor, and autonomic fibers in the nerve, but cranial nerves are often specialized. Some are only motor, some are only sensory, some have combined sensory and motor, and there's pretty much two that have sensory, motor, and autonomic. So they're a little more specialized than the spinal nerves. And you can think of the cranial nerves as being like the nervous system for the head, if you want to think of it that way, or the face, really. So a huge number of them, four, in fact, four of the 12, a third of them, are have to do with vision. So either vision itself or the movement of the eyes. So a lot of the nervous system resources are dedicated to vision. So that kind of tells you how important vision is. So the four main function of cranial nerves is to supply motor innervation to the muscles of the face, eyes, tongue, jaw, and two neck muscles, to transmit somatosensory information from the skin and muscles of the face and from the temporomandibular joint. So like I said, it's sort of like the nervous system of the face, if you want to think of it that way. Um, they also transmit special sensory information related to visual, auditory, vestibular, gustatory, which is taste, olfactory, which is smell, and visceral sensations. And then they provide some parasympathetic regulation of pupil size, curvature of the lens, heart rate, blood pressure, breathing, and digestion. So cranial nerves, even though they don't take up that much space, they really have a lot of important function. So we're just going to look at a summary of the cranial nerves. Usually cranial nerves are listed by a Roman numeral 1 through 12 and their name. So cranial nerve 1, it's usually CN1, and it's the olfactory nerve. It's sensory only. It's a special sense smell. And interestingly enough, it's the only sensory information that goes directly to our brain. It does not pass the thalamus. So a lot of the things that we perceive as taste are actually smell. So pretty interesting. Olfactory nerve. We're not going to spend a lot of time on it. The optic nerve is cranial nerve 2, sensory only, special sense vision. So the optic nerve, and we will talk a little bit more in the vision chapter about the optic nerve pathway and optic nerve lesions. The third, the fourth, and the sixth cranial nerves are all motor nerves serving the muscles of the eye. So cranial nerve 3 is the oculomotor nerve, and it serves the muscles of the eye. Cranial nerve 4 is the trochlear nerve, and it has some of the specific muscles in the eye. And the cranial nerve 6, the abducens, serves the other specific muscles, lateral, rectus, eye muscle. So those are 3 cranial nerves fully dedicated to the motor functions of the eye, and 1 fully dedicated to the sensory part, the optic nerve. So cranial nerve 5 is the trigeminal nerve, and it is both sensory and motor. It's one of the ones that's both. And it's sensory information from the face and mouth, and motor information from the muscles of mastication or chewing. So the trigeminal nerve really does innervates a lot of the face and mouth. The cranial nerve 7 is the facial nerve, and it is also both sensory and motor. It serves the muscles of facial expression, so any of our facial expressions, which is really important for, living in a society. We read a lot on people's facial expressions. It also serves the lacrimal glands and the salivary glands. So it has sensory and motor functions. Cranial nerve 8, super important, sensory, um, with two parts. The vestibulocochlear nerve is the name of the eighth cranial nerve, and it has one part that is vestibular and one part is cochlear. So the vestibular part of the nerve has to do with equilibrium. So basically, it transduces gravity information into neural energy that our brain can understand, tells us where we are in space. And the cochlear nerve is hearing. So that's all sensory stuff. And we will talk a little bit more about the vestibular system in the vestibular chapter. So the cranial nerve 9, the glossopharyngeal nerve, is also both sensory and motor. It serves the pharynx of the throat for swallowing. That's the motor part. And the posterior third of the tongue, so that's our part of our taste buds, are innervated by the glossopharyngeal nerve. So swallowing, salivating, and taste buds, obviously the glossopharyngeal nerve has a lot to do with eating. Cranial nerve 10, the vagus nerve, it's both sensory and motor, and it has some autonomic function in the parasympathetic motor regulation of visceral organs. And so parasympathetic, remember, it's rest and digest. This is the digest part. So a lot of the cranial nerves have to do with vision, eating, digestion, all important things, right? The vagus nerve also perceives sensation from visceral organs. So it's sensory, and the parasympathetic, it's the autonomic function. Cranial nerve 11, the accessory nerve, it's motor, and it serves the muscles that move the head, neck, and shoulders. So upper trapezius, or the whole trapezius, sternocleidomastoid, and it is involved in the information, the slow pain information in the divergent tracts in the spinomesencephalic tract that turns your head towards the source of pain. The cranial nerve 11 innervates those muscles that do that. Cranial nerve 12 is the hypoglossal nerve. It's a motor nerve that serves the muscles of the tongue. So any tongue movements are important for speaking, eating, swallowing, all those things. So the hypoglossal nerve, cranial nerve 12. So really, there's lots more to know about cranial nerves, but that is all we're going to talk about. So hopefully you're happy. But what I would like you to be able to, given a cranial nerve, tell me what its basic function is.